Hello and welcome to Speaking of Health, a place where you can learn to live a longer and healthier life. I'm your host, Jason Howland, and our guest today is board-certified ophthalmologist at Fairmont Medical Center, part of Mayo Health System, Dr. Daniel Peterson. Thanks for joining us.
My pleasure, Jason. Thanks for having me.
Well, before we get into the heart of today's topic, which is diabetes in the eye, let's talk generally about ophthalmology. For folks that don't know, what do ophthalmologists do?
Sure, that's a great question. An ophthalmologist is a physician, so someone who's been to medical school and then done additional training in learning about diseases and conditions that affect the eye and surrounding tissues.
So what kind of ailments do you help treat and diagnose?
Yeah, we see patients of all ages, from newborn babies all the way to geriatric patients, and we deal with any kind of conditions that come up with the eye. Some of the more frequent things that come up, cataracts or a cloudy lens in the eye that happens as folks get older, glaucoma, which is a high pressure inside the eye, macular degeneration, which is a problem that develops in folks as they get older as well. But we do see people just for routine eye exams as well.
Now, do folks have to be referred to you from another doctor, or can they set up an appointment directly with you?
Yeah, they can call our office directly, and they don't need any kind of referral. They can just call up and make an appointment for whatever kind of eye problem or concern that they have.
Okay. Well, our topic today is diabetes in the eye. And first off, let's talk about diabetes specifically. It affects millions of Americans. What exactly is diabetes?
Diabetes is a condition where the blood sugar is not normal. There's a hormone called insulin which regulates blood sugar, and in diabetics, either the body doesn't make enough insulin or the body is resistant to insulin's effect, and so that leads to increased concentrations of sugar in the blood.
And this affects many, many people, right?
Yeah, current estimates are that it affects anywhere from 5 to 12% of the United States population, and it seems to be on the rise.
Wow. And so what are some of the symptoms of diabetes?
Initially, folks can complain of being excessively thirsty, having to go to the bathroom very frequently, generalized weakness or weight loss is possible, and quite frequently blurry vision.
And that's what we're talking about today, how diabetes can affect your vision. Specifically, what does diabetes do to folks' eyesight? What can it do?
Diabetes can affect your eyes in multiple ways. Glaucoma, like we talked about, or a high pressure in the eye, is about 40% more likely to develop in someone with diabetes than someone without it. Cataracts, which again are a problem that typically affects older adults, is more likely and more frequent in people with diabetes. But the most severe problem that diabetics can develop is called diabetic retinopathy.
And what exactly is that?
The retina is the tissue that lines the back of your eye that helps turn the light into a picture, which is then transmitted to your brain. And diabetic retinopathy refers to damage that occurs in that fine structure in the back of your eye.
And I would assume the eye is a very delicate organ. When you have damage to the eye, it can be pretty significant.
Absolutely. We think that those high blood sugars damage the very small blood vessels that are found in the back of the eye. And over time, that makes those blood vessels often leaky, where they can leak blood or components of blood, and that can cause some of the problems that we see develop.
So if I have diabetes, how concerned should I be of diabetic retinopathy?
If you're diabetic, you should absolutely have a dilated eye examination by an ophthalmologist, because the longer you have diabetes, the more likely you are to develop diabetic retinopathy. After 20 years, it's estimated that nearly 100% of type 1 or insulin-dependent diabetics have some form of retinopathy, and about 60% of type 2 or non-insulin-dependent diabetics have retinopathy.
So it's not a question of if it's going to happen, it's when, for the most part.
Yeah, for the most part, that's true. Now, in type 1 diabetics, often they do not have retinopathy initially, so we can wait a few years before we screen them. But in type 2 diabetics, we think that they've had diabetes for some time before they're diagnosed, so that we do recommend having an eye examination when they are diagnosed.
So if you have retinopathy, diabetic retinopathy, will you see symptoms right away?
Oftentimes not initially. The changes can be mild enough where the patient doesn't develop any kind of visual problems. That's why it's important to have your eye doctor take a look inside and see if you have any signs of retinopathy. Things that the ophthalmologist may see include some blood in the eye called hemorrhages, some lipid components called exudates, or edema or swelling of the central vision.
And you can see this in the eye exam, I'm assuming, right?
Absolutely.
So for folks that haven't had their annual eye exam ever, what kind of an experience is it? I'm assuming it's not too uncomfortable, right?
Oh, no. There should be very little, if any, discomfort associated with it. What will happen is that we'll put some drops in the eyes, which may be a little bit uncomfortable, but very briefly. And then we'll dilate the eyes, and so the eyes will be a little more light sensitive for a few hours after the examination. But really, there should be no other discomfort.
And you can see with your instruments directly right into the eye, right?
Yes, absolutely.
Mm-hmm. What are some of the risk factors when it comes to diabetic retinopathy?
The most important one is poor control of the blood sugars. Now, it's been shown in multiple good trials with lots of patients that tighter control, stricter control of the blood sugars decreases the risk of getting retinopathy and decreases the severity of the retinopathy should it develop. But there are other risk factors, including high blood pressure, high cholesterol, narrowing of the carotid arteries in your neck, kidney disease, which often goes along with diabetes, and pregnancy or low blood count called anemia. All of those things can potentially worsen diabetic retinopathy.
But the biggest thing you're saying is if you have diabetes, manage your blood sugar levels, because that's the number one risk factor, right?
Absolutely. You should work closely with your primary care provider to closely manage those blood sugars, and that will decrease your risk of getting retinopathy.
And I don't want to scare folks, but if it's not managed, this can lead to blindness, right?
Yeah, diabetic retinopathy in its advanced stages is called proliferative diabetic retinopathy, and what that refers to is the growth of new blood vessels in the back of the eye where they're not supposed to be. We think that occurs because of the damage to the tiny blood vessels from the blood sugar essentially starves the retina for oxygen. Your retina then will release chemicals that make these new blood vessels grow, and these new blood vessels aren't normal. They break and bleed, okay, and that can cause the back of the eye to fill with blood called a vitreous hemorrhage. But in an advanced stage, it can actually lead to retinal detachment, which theoretically can lead to blindness.
So can it be treated? What is this something that it's just going to happen and you have to deal with it, or can it actually be treated?
Absolutely. Like we talked about earlier, the most important thing is to control the risk factors, but despite your best efforts, occasionally or frequently, you can develop diabetic retinopathy. Now that can be treated. In its early stages, oftentimes we may need to do a laser to decrease swelling in the back of the eye called the macula, which is the central retina. Sometimes if that doesn't control things adequately, we can use an injection of a steroid near the eye or inside the eye. In its more advanced stages where it becomes proliferative, more interventional treatments may be necessary, including more extensive laser, eye surgery to remove blood should it build up in the back of the eye, or some of the newer treatments may involve an injection of a chemical into the eye to try to get those blood vessels to shrink.
Okay. Well, what about prevention? Are there certain lifestyle changes that diabetics can do to avoid eye problems or at least slow them down? Obviously, like we've talked about, managing your blood sugar level, but what about just everyday stuff? Is there certain things they can do?
Other than controlling those risk factors, controlling your cholesterol, controlling your blood pressure, seeing your doctor regularly to controlling the blood sugars, those are really the most important things.
Okay. Well, Dr. Peterson, what about age factors? Are there certain ages where you should be more concerned that this could happen to you?
The main concern as far as age is how long you've had it, how long you've had diabetes, as far as how likely you are to get retinopathy. Like we talked about, the longer you've had it, the more likely you are to have it. So typically type 1 or insulin-dependent diabetics is more frequent in younger individuals, and type 2 is more common as folks get older.
And race can also be a factor too, right?
Absolutely. We know that African Americans and Hispanic individuals are more likely to develop retinopathy than Caucasians.
And why is that?
At this point, we're not 100% sure. It may have some genetic component to it. It may be that underserved groups may not receive as good of health care as other groups.
Mm-hmm. Well, what's the frequency of eye exams? How often should folks come in and get their regular eye exam, especially if they have diabetes?
Yep. Again, like we talked about, In the type 1 diabetics, we recommend an initial screening examination within the first 5 years after diagnosis.
And a lot of people probably don't realize, but the eye actually, a lot of blood vessels feed the eye, which is one of the reasons why the retinopathy happens, right?
Exactly right. We think that retinopathy is a consequence of damage to those teeny tiny blood vessels in your eye, and your eye is full of those small blood vessels. Other common complications of diabetes, including nephropathy or damage to the kidneys, or neuropathy, damage to the nerves, we also think is from the very small blood vessels that go to those structures.
And I would think in your profession, working on those small blood vessels, it's a very meticulous work, right?
Yes, we do very delicate treatments, including that laser treatment, which is sometimes necessary.
And how does that work? A laser on the eyes? It sounds a little scary, but it's very safe, right?
Absolutely. It is usually pain-free. It's something that is done in the office, so you don't need to go to the operating room. We use focusing lenses on the surface of the eye to focus the laser very precisely in the back of the eye where we need to do the treatment. So it sounds scary, but actually it's usually not a very big deal.
Now, is this something that's been around for a long time, the laser treatment, or?
Yeah, it's been around for more than 25 years, doing laser treatment to the back of the eye. So it has a very long and good track record.
Okay. Well, what about retinopathy? Does it affect both eyes, or is it just one eye, or how does that work?
Usually when we see retinopathy, it's going to be present in both eyes simultaneously. However, it can be asymmetric, especially if you have carotid artery disease. The carotid artery is the artery that comes from the heart and goes to the brain and the eye. And if there's narrowing on one side or the other, that means that less blood flow is getting to that side and that eye potentially, and therefore the retinopathy may frequently be worse on that side.
But for the most part, though, it generally affects both eyes, and the symptoms are pretty much the same in both.
That's usually correct, absolutely.
All right, so recapping, if folks have diabetes, what should they do to really prepare or prevent retinopathy?
The number one thing that they need to do is to work closely with their primary care physician controlling their blood sugars and any other risk factors they may have, like we talked about, high cholesterol, high blood pressure, low blood count, any kind of kidney disease. Once we know that they have diabetes, they should be followed on a regular basis by an ophthalmologist for dilated examinations of the back of the eye to make sure that retinopathy is not developing. If it is developing, more frequent examinations and possible treatment may be necessary to manage the diabetes and decrease the risk of developing vision loss and potentially blindness.
All right, and so if they have retinopathy, more frequent exams, otherwise just an annual eye exam from the ophthalmologist? Or?
Absolutely.
Well, unfortunately, that's all the time we have, but we want to thank Dr. Daniel Peterson, board-certified ophthalmologist at Fairmont Medical Center, for joining us today on Speaking of Health.
Thank you for having me.
And to make an appointment with Dr. Peterson at Fairmont Medical Center at the eye clinic, you can call 507-238-4311 or 1-800-234-6141. Have a great day, everyone, and be healthy.